This is Jim Rutka from the Hospital for Sick Children at the University of Toronto, and together with my colleagues listed on this slide, we will be discussing medulloblastoma in adults in this PowerPoint presentation. The objectives here are to understand the principal differences of adult and pediatric medulloblastoma, to implement the knowledge in diagnostic approaches, and to know the different treatment algorithms for children and adults, and where possible, to use best practices. When it comes to the epidemiology, age, gender ratio, and clinical presentation for medulloblastoma in adults, the important differences with pediatric tumors include the fact that this is a very rare tumor in the adult, less than 1% of CNS tumors, whereas it's about 25% of CNS tumors in children. In addition, there is a male predominance, which you do not see in adult medulloblastoma that you do see in pediatric medulloblastoma. As for radiological presentations, you can see here that there is modest contrast enhancement when you have a cerebellar tumor, such as adult medulloblastoma, and these radiological features are very similar to what we observe in children. As such, the radiological presentation of adult medulloblastoma is represented by tumors that are found in the lateral cerebellar hemisphere, whereas in children they are found predominantly in the midline. The presence or absence of contrast enhancement and some of the other MRI features are pretty consistent between the two tumor types. As for the histopathology, what you can see here is that in children, the main subtype classically is medulloblastoma as a small blue cell tumor, the so-called classic designation for medulloblastoma. And in infants, you can see medulloblastoma with extensive nodularity. In adults, the main histopathological subtype is desmoplastic and sometimes classical. It's rare to see large cell anaplastic medulloblastoma. As for the molecular genetic features, what you can see on this slide are the three subtypes that can occur in adult medulloblastoma compared to the four subtypes in pediatric medulloblastoma. You can see the localization of the sonic hedgehog variant of medulloblastoma in 60% of patients, where it's situated typically in the cerebellar hemispheres, whereas in children, group 4 accounts for the most frequently found subtype of medulloblastoma. As for prognostic factors, gross total resection and absence of the large cell anaplastic variant are associated with better survival, brainstem involvement in metastatic disease associated with worse survival, and there are some prognostic markers that are listed on the slide. And overall, the survival is similar between adult and pediatric medulloblastoma with some exceptions. As for the treatment algorithm, if you follow the red color on this slide for adults, you can see that staging is performed at first, which includes the requirement for MRI of the brain and total spine imaging. A gross total resection is, of course, preferable. Radiation therapy is required, including craniospinal irradiation at 36 gray over 20 fractions and a boost to about 55 gray to the tumor bed. There are a number of chemotherapy regimens that are under evaluation, and these are being tested currently, but the typical drugs include vincristine, platinum, and cyclophosphamide. So in summary, for adult medulloblastoma, these are less frequent than in the pediatric population. There is a different distribution of histological variants and molecular genetic subtypes. The prognosis is similar for some of these subtypes as they are in children. The main treatment for adults is gross total resection followed by irradiation, and at this moment chemotherapy is being explored with a number of protocols that are being considered. Thank you.